There are three groups of symptoms that are required to assign the diagnosis of PTSD. Recurrent re-experience of trauma, avoidance to the point of having a phobia of places, people, and experiences, chronic physical signs of hyperarousal, including sleeping problems, trouble concentrating, anger, poor concentration, blackouts, or difficulty remembering things. Symptoms of PTSD that tend to be associated with combat PTSD include problems regulating feelings, which can result in suicidal thoughts, explosive anger, or passive aggressive behaviors. A tendency to forget the trauma or feel detached from one's life or body, persistent feeling of helplessness, shame, guilt, or being completely different from others. How is PTSD assessed? For individuals who may be wondering if they should seek evaluation of PTSD by their medical or mental health professional, self-tests may be useful. The National Institute of Mental Health offers a self-test for PTSD. The assessment of PTSD can be difficult for practitioners to make, since sufferers often come to the professional's office complaining of symptoms other than anxiety associated with traumatic experience. Those symptoms tend to include body symptoms, depression, or substance abuse. Individuals with PTSD may present with a history of making suicide attempts. In addition to depression and substance abuse disorders, the diagnosis of PTSD often occurs in bipolar disorder, eating disorder, and other anxiety disorders like obsessive compulsive disorder, panic disorder, and generalized anxiety disorder. How is PTSD treated? Well, treatments for PTSD usually include psychological and medical treatments, provide information about the illness, helping the individual manage the trauma by talking about it directly, teaching the person ways to manage symptoms of PTSD, and exploration and modifications of inaccurate ways of thinking about the trauma are the usual techniques used in psychotherapy for this illness. This education thereby increases the likelihood that inaccurate ideas that persons may have about the illness are dispelled, and any shame that they may feel about having it is minimized. How can people cope with PTSD? Well, some ways that are often suggested for PTSD patients to cope with this illness include learning more about the disorder, as well as talking to friends, family professionals, and PTSD survivors support. Where can people get this help? Especially for combat, people can get help from Marine for Life, Military One Source, ALAF for veterans, military severely injured vets, and for regular civilians, any psychiatrist can refer them to the correct help. Thank you.